As the sun began to rise over the city, the hospital ward was already bustling with activity. Nurses rushed from room to room, checking on patients and administering medications. Among them was Rachel, a dedicated nurse who had been working at the hospital for many years. Despite the early hours and the demanding workload, Rachel greeted each patient with a warm smile and a gentle touch. Rachel had always been a hard-working and diligent nurse. She would often work long hours and never complained about the workload. However, over time, the stress of the job began to take a toll on her mental health. She started to become anxious and irritable, and her colleagues noticed that she wasn't herself. Despite her struggles, Rachel continued to work, and her colleagues tried their best to support her. However, one day, Rachel's mental health reached a breaking point. She was caring for a patient who was very ill, and despite her best efforts, the patient passed away. Rachel was devastated by the loss, and it triggered something within her. She started to become delusional and paranoid, believing that she was responsible for the patient's death. She became obsessed with the idea that she had to make up for what she had done and began to take increasingly drastic measures to save her patients. She would sneak into patients' rooms in the middle of the night, administering medications and treatments that were not prescribed. Her behavior became increasingly erratic and unpredictable, and her colleagues began to worry for the safety of their patients. Eventually, Rachel's colleagues reported her behavior to hospital management, and she was suspended from her job pending an investigation. She became even more unhinged, believing that her colleagues were trying to sabotage her and that she was the only one who could save her patients. In the end, Rachel was diagnosed with a severe mental illness and was committed to a psychiatric hospital for treatment. Her colleagues were saddened by her descent into madness and hoped that she would receive the help she needed to recover. The story of Rachel serves as a cautionary tale about the importance of taking care of one's mental health, especially in high-stress professions like nursing. It also highlights the devastating consequences that can occur when mental illness is left untreated.